If your child is suffering from severe eczema and has frequent eczema flares, I'd like to discuss with you Dr. Wright's modified wet wrap technique. This is steroid-free, it's more natural, and easy to be done at home. The way to remember it is wet. W stands for wet the skin. Bathe the child. You don't necessarily have to use soap or cleansers, just make sure the baby's skin is wet. E, emollient, otherwise known as your moisturizer. The thicker the better, something in a jar, but if your baby or child can't tolerate greasy ointments, a cream is fine too. You just want to make sure it's thick, and that's what an emollient is. T stands for tight pajamas, wet. Here it goes. Bring all your supplies into the bathroom, okay? Make sure the room is nice and in good temperature. Wet the baby's skin. Smear a thick paste of your moisturizer all over the baby's face, arms, legs, head to toe, just like you're frosting a cake. And then, but remember, don't dry off. And then T, put on some type of tight, breathable, snug PJs or onesie. There are no side effects to wet wraps because it's natural, it's steroid-free. The key is, by wetting the skin, you open up the pores. By putting a thick layer of the moisturizer, you're sealing it into the pores, and then putting your tight PJ over top of it, you're keeping them nice and snug so the grease and the lotion is not all over the bed sheets. Again, modified wet wrap, W-E-T, minimizes flares of eczema, helps the baby sleep at night, and parents.